Hi guys, so I'm presenting today a webinar about the power of the blood work. So today we'll be talking about not just the blood work, but also the main symptoms why I see my patient in the clinic, which is fatigue. So the real fatigue, not just like being busy, not just stressed, not just like calling alive, I'm talking about when women and men like wake up tired, they rely on caffeine to feel good, they feel foggy, very flat, unmotivated, and not like themselves anymore. So we are going to talk about why this is happening and how our panel and blood work can give us a real answers. So you've probably been told so many times that your blood work is normal, but you still feel tired, foggy, bloated, just anxious, just like not yourself. So because we have to remember that medicine, especially Western medicine, looks mostly for the disease. They don't really look for you to feel amazing. It's the whole point of medicine is just to find a disease and treat it. We are here to kind of make you feel optimal and as like best version of yourself. So the main symptoms, it's fatigue, and fatigue, it's not normal. So if you're feeling always like tired and exhausted, it's a signal. It's a signal from your body that something is wrong. So we are not designed to feel exhausted every day. And then normal fatigue, it's not like a normal fatigue. Fatigue, it's not normal, and it's not a normal signs of aging. It's not a weakness, and also it's not your personality trait, and it doesn't mean you have to push through it. Fatigue, it's an information, and your body's trying to communicate with you. And the blood work, our specific blood work panel will help you, help us translate that message from your body. So a lot of people tell me like, oh, I feel so much energy. I'm not fatigued. However, fatigue, it can show sometimes differently. It's not always like falling asleep at your desk. Sometimes it can show us as a brain fog. It can show as a stubborn weight, or especially around the belly or face. It can show up as irritability, as anxiety, poor sleep, and loss of drive and libido. So many people don't realize, but it's connected. So what most patients I've seen, they've been told before that their labs are normal, but normal just means you don't have diagnosable disease. Does not mean your body is functioning optimally. So conventional medicine just looks for disease, and we look for dysfunction. The gray zone, it's where people feel awful, but are not sick yet, or not sick enough. So that's why we do this very extensive hormonal panel. So the power of the blood work basically turns your symptoms into clarity. It removes the guesswork. So instead of assuming stress, depression, burnout, we actually see what's happening inside your body. And labs gives us like the whole roadmap of everything what's going on in your body. So this is how our panel look like. It's a very extensive panel, has a couple components to it. I put them in these components, but of course, those are all connected. Those are all dots in your body, because energy, it's not just controlled by one system. It's hormones, it's thyroid, it's your nutrients, it's how you metabolize things, your cellular health, all of this is working together. So this panel was designed specifically to evaluate fatigue from every single angle, not just one piece of a puzzle. So we'll talk about each specific blood test and what they mean and how we interpret them. So why our panel is different? Because we don't look at just one thing, just one lab. We look at the full energy equation. And I want to quickly talk about optional deep dives, because our panel is discounted. Instead of $495, it's $295 in January. But you can additionally add some advanced cardiac panel to your testing, which we call it advanced cardiac panel. That has a couple components. So first of all, has a lipid panel. You probably know a simple lipid panel, every doctor tested. I don't like lipid panel because it shows us usually cholesterol, and people get so caught up about cholesterol levels. We have to remember that cholesterol is like the good molecule. Your brain needs it and prevents a future Alzheimer and dementia, so it's really good for your brain. So by just checking simple lipid panel, we don't really see the big picture. What matters more are like the advanced testing, which is like homocysteine. So think about homocysteine as the silent artery irritator. If you have it elevated, it's basically causes a lot of inflammation, damage your vessels from inside, and it's really linked to heart disease, stroke, and cognitive decline. So homocysteine is so important to check because it damages your artery, and then when they're damaged, the plaque forms. So how we treat elevated homocysteine, well, it depends. Sometimes it's because of lack of B vitamins or the detox pathways, in your liver. So we address that. We also check for ApoB, apolipoprotein B. It's the real atherosclerosis risk marker, and it's way more predictive for future heart attack than just elevated LDLs. So it's not exactly about how much cholesterol you have, but also how many of these little bullets, aggressive bullets, ApoB you have in your vessels that go and damages your vessels. Another very important particle that we measure in our advanced cardiac panels are apolipoprotein A, which is basically like cholesterol cleanup crew. ApoA takes the bad particles from your vessel and put them back in the liver. So clean. So we want ApoA to be high and we want ApoB to be low. So more ApoA, better protection for your vessels. Another important test we do in cardiac panel, it's lipoprotein little a, and that's your basically genetic wild card, and some people are just born with elevated lipoprotein A, and doesn't necessarily tells us, if you're healthy or not, you just have it elevated genetically. So then we have to treat you a little bit more aggressively, to remove that protein from your system, but also to lower your inflammation and all of that. NMR lipoprofile, amazing test, just basically checks for particle size and behavior of those particles. So it's like a game changer if it comes to, like testing for lipids. It tells us how many small, how many dense particles you have, what's the number of each particle. And then very often that one can show us if there's risk for cardiovascular diseases, even if cholesterol looks fine. And lastly, this is HSCRP, which is inflammatory marker. So because heart disease, it's inflammatory disease. So it's not just cholesterol problem. And then when inflammation is high, arteries are more vulnerable. Okay, so let's dive deeper into the whole panel. So first we do CBC and CMP, which is complete blood count, CBC, and comprehensive metabolic panel. So those are your thorough foundation. So if your cells are not getting enough oxygen, nutrients, or proper detox support, you will feel tired. So CBC and CMP will tell us about your anemia, your hydration status, your blood sugar trends, liver, kidney stress, all of that, because all those things can drain your energy. Also, we check for your vitamin D and vitamin B12, because vitamin D is linked to fatigue, low mood, poor immunity, hormone imbalance, while B12 also causes fatigue, brain fog, and a type of poor focus and neurological symptoms. So even if you are on a borderline normal, that's not enough. These deficiencies are incredibly common and they're easily fixable. Another thing, which is the most important, what we test in our panel are sex hormones. So think about estrogen as the beauty hormone, progesterone is the chill hormone, FSH, it's your message from your brain to your ovaries, and testosterone-free in total summary is just like stamina, and LH is the message as well from the brain to ovaries or to testes to produce more testosterone sperm counts. So low and imbalanced testosterone, estrogen, progesterone also can cause fatigue, anxiety, poor sleep, a lot of PMS symptoms, weight gain, and then burnout. And very often women or men that have a high estrogen, they always see why I'm crying, really makes us emotional if the hormones are in balance. FSH, like I said, is this tells your it's basically your brain tells your ovaries start yelling at the ovaries to start working harder and start responding to that message. And this is very common to have it elevated in perimenopause. So when woman feels like they're losing their mind, that's not actually losing your mind, it's biochemistry. So, and testosterone, which is my favorite, it's not just about sex. It affects energy, your drive, your confidence, your muscle mass, mood, motivation, all of those. And LH determines if you have a signal from the brain to testes to even produce testosterone or the sperm count. So when we fix it, people often feel like, oh my gosh, is this what normal is? Yes. IGF-1, so IGF-1 is basically like your body's repair signal. It tells cells to grow, repair, regenerate, and all the cells, from muscles to skin to organs, everything. So when you have low IGF-1, that explains why you're feeling tired, very achy, or feel like you never can recover from workouts. That's usually symptoms of low IGF-1. When it's optimal, you have a better energy, faster healing, stronger recovery, and more resilience. So fun fact is we use a lot of growth hormones, peptides, growth hormone releasing peptides like CGC, ipamorelin, tesamorelin to naturally boost your IGF-1. So it's basically like telling your body, wake up, it's time to repair and rebuild. And then we have very complete thyroid testing. So thyroid, it's like your body's energy engine. So think about TSH, it's the driver. So TSH is the message from the pituitary gland to your thyroid. So it's the driver that tells your thyroid like step on, go on, And then your thyroid produces free T4, which is like the gas in a tank. So, but for the car to drive, you have to turn that gas into motion. So that's what T3 does. T3 is this active thyroid hormone that basically turn that gas into motion, makes you keep going, gives you more energy, more stamina. So many people have like normal TSH because that's what the doctors usually check, just TSH. But the conversion of T4 to T3 is poor. That's why they feel very fatigued. They have a weight gain and brain fog. Anti-TPO antibodies. So that's basically your immune system attacking your thyroid, sabotaging your engine. So by testing all three, we see production, conversion, and sabotage, like the full picture of your thyroid. So let's talk about a little bit more about that thyroid autoimmunity. So when you feel tired, anxious, achy, foggy, you can feel those things way before your thyroid is suboptimal. Why? Because for many, many years, that thyroid was under attack. Your own immune system was attacking that thyroid gland. So you can slowly over time destroy your thyroid tissue, and fatigue is one of the first signs and symptoms of it. So when we catch it early, we can reduce your inflammation, we can protect your thyroid function, and we can optimize your energy, and even we can work on your immune system to not be so irritated. There are supplements for that as well. So yeah, when it's elevated, it's called Hashimoto, autoimmune thyroid condition. So what's the whole power of blood work and why we do it? So number one thing, the most important thing is to connect all the dots. So blood work is way more than just numbers. It's like the whole map, the whole guide about your health. So because, for example, low nutrients can affect your thyroid, the thyroid affects your hormones, and hormones affect your metabolism and mood, and this is all connected. So we connected all those dots, and then fatigue finally makes sense. And then it's become treatable. Because when we fatigue or feeling low, it's not just one missing vitamin or one low hormone. It's usually a bigger picture. It's usually a mix of thyroid, hormones, nutrients, metabolic issues, and then and labs will let us see the whole story. And number two reason why the blood work is so powerful is definitely give you that proof that you are not crazy, you know, and sometimes you feel like everything is normal, my blood work, and doctors just keep dismissing me, but I feel internally deep there that something is wrong. Like a lot of my patient feels like, oh, I knew something fell off, but everyone told me it was fine. So that's why blood work finally confirms your instincts. Like you were right the whole time. It validates your experiences. So that alone, it's so empowering. Like that's what I always hear from my patient. Like not that I'm happy that you found something in my blood work that it's not normal. I'm happy that finally I have the answers to why I feel the way I feel, and I feel validated. And optimization changes lives. This is where people always tell me, like, I feel like myself again. So this is the moment patient gets usually very emotional. And then when the labs are optimized, not just normalized, they have more energy, the sleep improves, mood stabilizes, and life just gets lighter again. And over time, of course, there's a lot of things that we don't notice right away, like increased bone mineral density or increased muscle mass, all those better working mitochondria. Those things don't usually change overnight, but you see those results, years after optimizing your hormones, your nutrients, your detox pathways, and your thyroid function. So individually, very often all those symptoms get dismissed, but they together explain how you're feeling perfectly. So this is a very comprehensive blood panel. So how the process look like? So for that $299 special instead of $495, you have basically like three parts to it. First one is the pre-consult. So it matters because we need to have your whole story, like your past medical history or the medication you're taking, all the symptoms you're experiencing. That detailed history let us figure out also what to add to test if necessary. So you come to the clinic after setting up your appointment, and we talk to you, one of the providers, gather all the information about you. And then the second part to it is, of course, a quick needle stick, which is lab draw. We test all the testing I mentioned before, and then we send them to the laboratory. And a week later, you come to us for lab review. And this is very comprehensive lab review. We go over every single result. We explain what's optimal, not just what's normal. We explain what's off and what to do next about every single lab result. And we are not rushing. We are not confusing you. We are very clear. You can even have access to our notes, medical notes after, because we type everything that we talk to you about. So it's not like you have to memorize everything. What we explain to you, you have access to your own notes. And then I want to make sure always that my patient understand their labs. Like they know exactly what I tested, why I tested it, what the results mean. So we go over every single test. So this whole panel, it's discounted, and this is for anybody that just feels tired all the time, that anybody that feels like coffee that doesn't even help them in the morning. They just cannot get out of the bed. They just don't feel like themselves. They have low stamina, low sex drive, or just in general, like life drive. So if this all resonate with you, I think it's time to finally test for all the hormones and nutrients and all of that. So this is the whole panel, just the summary of it again. Like I said, we separated this into like portion, which is metabolism, how your liver metabolizes things, how your kidneys excrete those things. Also lactate dehydrogenase, which is almost like a cancer marker, tells us if there's some kind of tissue damage going on. It could be from slow recovery. Vitamin status, B12 and vitamin D, very important for energy. Hemoglobin A1C, summary of your sugar level in the last 3 to 4 months. So it's a test you cannot cheat by just, not eating for 24 hours or 12 hours before blood work. This is like your real sugar status. And of course, we check for longevity and recovery by checking your IGF-1 to see if your tissue can even repair, if they have capacity to repair. And all the beautiful sex hormones like testosterone, estradiol, progesterone, LH and FSH, and also the complete thyroid picture that includes thyroid stimulating hormone, free T3, free T4, and anti-TPO. A lot of people ask me why I'm not checking total T3 and total T4. So total number of particles of hormones, it's just all of them, the active, inactive. Total means there are hormones that are attached to certain proteins that inactivates them. So having optimal levels of total T3 and total T4 doesn't guarantee you're gonna feel good. We want to know how much of those free hormones you have circulating in your blood because they're the one that does all the magic. So if you are interested and you think you deserve energy, not just to survive, but to live, this is your sign to do the blood work with us, especially this new discounted price, because it's good to stop guessing and start listening to your body and bring your energy back. So this is your moment. If you learn why fatigue happens, how labs connects the dots, and what optimization can do for your energy, mood, and life. So booking, it's pretty simple. You just have to call our office and go on our website, and we'll schedule pre-consult for you. During that pre-consult, we'll also draw your blood, and then we'll schedule you in the end of that appointment for detailed lab review a week later. And you can, like I said, you can call us 858-609-0866, or you can book it online. And remember, you deserve to feel like yourself again. Let me know, guys, if you have any question about the hormonal panel. I'll stay here for a little bit to see if anything pops out on Instagram or Zoom. And my name is Martina Ersky. I'm a nurse practitioner and Joy Wellness Partners. I don't know if I mentioned this before. I just like jump straight to presenting. And thank you so much for listening. And we still have 2 more weeks till January ends for this special, and it's for everybody. It's not just for new patients, $299, all comprehensive blood work with review, but also for existing patients. So if you about to do your annual hormone panel anytime soon, maybe today it's better to do it this month because of the amazing discount that we offer. When making an appointment, what do we specifically ask for? Ask for the hormone blood draw and pre-consult. So say you want to optimize your hormones and nutrients and ask for just initial pre-consult and lab draw. Yeah, I saw that question popping. Awesome. Thank you, guys. It was good to talk to you. And then don't forget, we also do a lot of add-ons like that advanced cardiac panel. Since this one is so discounted, we also discounted the add-on. Normally it's $495 as well. So if you have family history of cardiovascular conditions, heart attacks, elevated cholesterol, Alzheimer and dementia, this is a good add-on as well, this comprehensive cardiac panel that will dive deeper into not just your cholesterol levels and the HDL, which is good cholesterol, and then LDL, which is bad cholesterol, but also we'll break down all the particles and their sizes, and we give us way more information about those inflammatory marker and homocysteine and ApoB. Thank you for listening and have a wonderful day. Bye.